We all know how it feels to wake up, have a cup of coffee, and go about your day. But what if one morning something didn't feel quite right? Maybe you didn't notice it at first, or maybe it's something small you brushed off as nothing to worry about. The truth is, our bodies send us signals all the time, but sometimes we don't listen closely enough, and it can lead to bigger problems. So, what if you could catch those signs early and take action before something serious happens? Today, I want to talk to you about 7 warning signs that should never be ignored, no matter how small they seem. These are the moments when your body is trying to tell you something important, something that could save your life. As we age, it's easy to think that certain aches, pains, or changes are just part of getting older. But it's essential to recognize when something is more than just the usual wear and tear. If you can learn to spot these signs, you might just be able to act quickly enough to prevent a much larger problem down the line. In this video, we'll talk about 7 critical signs that mean you should head straight to the hospital. And no, this isn't about scaring you. It's about empowering you. You're in charge of your health, and recognizing these warning signs is one of the best ways to take control. Let's begin with the first one, and I want you to really think about this. Have you ever noticed a change in the way you speak? Maybe you've had moments when your words didn't come out quite right, or you felt like you were struggling to form a sentence. You know, the kind of moment where you're thinking, what's going on with me? Now, I don't know about you, but if that happened to me, I'd probably shrug it off at first. After all, we all have those little brain fog moments, don't we? But here's the thing. Slurred speech or a drooping face is one of the most urgent red flags your body can send, and it's something you should never ignore. You've probably heard of strokes, but did you know that in many cases, they don't come with the dramatic symptoms we see in movies? It's not always a sudden, crushing pain in the chest or a dramatic collapse. For some, it's as simple as feeling off while talking, like your words don't sound the way they used to. Maybe your smile looks a little uneven, or when you try to lift your arm, it just doesn't quite go up like it used to. These signs can feel subtle at first, but they're serious, and acting quickly is the key. Let me tell you about Robert, a 68-year-old Vietnam veteran. One morning, he was having coffee, just going about his usual routine. All of a sudden, he dropped his cup. It didn't make sense. Then he tried to call out to his wife, but when he spoke, his words didn't come out the way they should. His wife noticed his smile was uneven and immediately called for help. Robert got treatment within the hour, and thanks to his wife's quick thinking, he made a remarkable recovery. He later said, "If she hadn't acted fast, I might be in a wheelchair or worse." This is why doctors use the acronym FAST, face, arms, speech, time, to help us recognize the warning signs of a stroke. But what's crucial to remember is that the T for time is the most important. The faster you act, the better your chances of recovery. So, if you notice that your words are slurred or your face is drooping, don't wait it out. Don't try to rest it off. Call 911 immediately. Every minute counts when it comes to a stroke, and by taking action fast, you could save your ability to talk, walk, or remember. Let's move on to another one. This one is a little harder to ignore, but I want you to really take it seriously. Sudden chest tightness or pain. Have you ever experienced that feeling of tightness in your chest? Maybe it felt like pressure or squeezing, like something just wasn't right. It could even spread to your shoulders, neck, or jaw. It's easy to assume it's just indigestion or anxiety, especially as we get older. But if you're feeling this kind of pressure or discomfort, it might be your heart sending out a distress signal. Helen, a 74-year-old retired teacher, had a strange experience one afternoon. She was reading a book when she suddenly felt a tightness in her chest. It wasn't excruciating, but it lingered. She thought maybe it was gas, but something told her to call her daughter. Her daughter insisted they go to the hospital, and it turned out Helen had suffered a mild heart attack. Thanks to her daughter's quick response, Helen made a full recovery. She later said, "If I had waited, I might not be here." When it comes to heart problems, especially as we age, things aren't always as dramatic as what we see on TV. Sometimes the signs are subtle. You might feel dizzy, short of breath, or suddenly tired for no reason. The key here is that these aren't things to monitor or brush off. These are signs to act on immediately. Don't wait for it to get worse. If you're feeling that chest discomfort, even if it's mild, don't ignore it. Trust your body and get checked out. Now, I want to talk about something that might seem less urgent but can still be incredibly serious. Shortness of breath without exertion. Have you ever found yourself gasping for air, even when you haven't been doing anything physical? Maybe you were just sitting down, watching TV, or lying in bed, and suddenly you couldn't catch your breath. That feeling can be unsettling, but it's something you should never ignore. Let's look at Walter's story. He was 76, in decent shape, and one evening while relaxing at home, he suddenly felt like he couldn't get enough air. There was no chest pain or fever, just a feeling of breathlessness. His daughter convinced him to go to hospital, where they discovered a blood clot in his lung. If Walter had waited, he might not have woken up the next morning. The point here is that if you suddenly can't breathe, even when you're just resting, it could be a sign of something serious, like heart failure or a blood clot. Don't wait for it to go away. Take action. If you've been with me so far, I'm sure you're beginning to realize just how important it is to listen to your body. These first 3 signs, slurred speech, chest pain, and shortness of breath, are all serious. But they're not the only ones. I'll share more signs with you in just a moment. Before I do, though, let me ask you to pause for a second and reflect. Have you ever brushed off something small, thinking it wasn't a big deal, only to realize later that it was more serious than you thought? Remember, your health matters, and you deserve to listen to your body. So, if you're finding this video helpful so far, let me know in the comments. Just type yes below. It lets me know you're still with me, and I'd love to hear your thoughts. Also, don't forget to subscribe if you haven't already. So let's continue with the next set of signs that should never be ignored. I promise, they're just as important. Now, let's talk about confusion or sudden disorientation. This is something we often brush off as just part of aging, isn't it? Maybe we forget a name, lose track of time, or get disoriented for a minute. We might think, oh, I'm just tired, or it's probably nothing. But if you or someone you love suddenly becomes confused or forgets familiar things, it's time to take action. Take Linda, for example. She was 80 years old and had lived independently for years. One morning, her neighbor found her standing in the hallway of their building, looking confused and unsure of how she had gotten there. She was fully dressed, but kept repeating the same question. Her family thought she might be tired or maybe dehydrated. But when they took her to hospital, doctors discovered she had a urinary tract infection that had triggered a sudden onset of delirium. After receiving treatment, she quickly returned to her usual self. Her daughter later said, "I didn't know confusion could come from something like that. Now, I'll never ignore it again." This is a perfect example of how the brain can give us these subtle signals when something is wrong. For older adults, confusion can be a red flag for serious conditions like strokes, infections, or even a lack of oxygen in the body. Sometimes, the brain is the first organ to show signs that something is off, and when that happens, it's time to get checked out. If you notice that you're forgetting things suddenly or becoming disoriented in familiar places, don't just brush it off. Don't assume it's just getting older or that it'll pass on its own. It's important to treat this with the seriousness it deserves, because in some cases, those moments of confusion could be warning you of something that needs immediate medical attention. Next, let's talk about abdominal pain. We all get a stomach ache from time to time, maybe after eating something that didn't sit well or just from gas. But there's a big difference between your usual discomfort and severe, sudden abdominal pain. If you ever experience sharp, persistent pain in your abdomen, especially if it gets worse with time, you should never ignore it. Frank, a 72-year-old widower, thought he just had a little gas one evening after dinner. He took some antacids and went to bed, thinking it would pass. But by morning, the pain had spread, and he could barely get out of bed. His daughter called for an ambulance, and the doctors discovered that Frank had a twisted intestine, which had cut off his blood flow. He needed emergency surgery, and it saved his life. Frank later said, "I thought it would pass, but I didn't realize how quickly things can get worse." Abdominal pain can sometimes be a sign of something as simple as indigestion, but when it's severe, sharp, or sudden, it could point to something much more serious like appendicitis, a ruptured organ, or even internal bleeding. For older adults, The risks are higher, and the classic symptoms aren't always as clear as they might seem. You might not have a fever or visible swelling, but your body is trying to tell you something. Don't try to tough it out. Go to the hospital. If you're feeling a sharp, persistent pain in your stomach that doesn't seem to go away, especially if it's accompanied by nausea or dizziness, don't wait. It could be something serious, and the sooner you act, the better your chances of recovery. Now, let's move on to something that might seem a bit less obvious: persistent vomiting. You know, we all get a little sick from time to time. Maybe a stomach bug or something we ate doesn't sit right. But if the vomiting continues for hours or if there's blood involved, that's a whole different story. It's no longer just a nuisance. It's a serious warning sign. Let me tell you about Evelyn, a 79-year-old woman who had been taking over-the-counter pain relievers for her arthritis. One evening, she started vomiting after dinner. At first, she thought maybe it was a shrimp she ate, but then she noticed dark flecks in her vomit. It looked like coffee grounds. That's when her grandson insisted they call for help. At the hospital, Evelyn was diagnosed with a bleeding ulcer that had been silently growing for months. If she hadn't gone to the hospital, she might not have made it through the night. If you ever experience persistent vomiting, especially if there's blood in it, even just a little, don't wait. It could be a sign of internal bleeding or something much more serious. This isn't something to try to sleep off or fix with a few sips of ginger ale. Blood in your vomit means there's something wrong inside your digestive system, and the only way to address it is with immediate medical care. Whether it's a stomach issue, liver complications, or a ruptured blood vessel, getting help quickly can make all the difference. I know this information might feel a bit overwhelming, but I want to take a moment and reflect. Have you ever experienced any of these signs, confusion, severe abdominal pain, or persistent vomiting, and dismissed them as nothing? Maybe you didn't want to be a bother, or maybe you thought it would pass on its own. It's easy to do that, but these signs are your body's way of speaking to you, and it's important to listen. Remember, this isn't about being paranoid or overreacting. It's about taking care of yourself. Your health is precious, and when your body sends out a warning, it's a call to action. So, if you're finding this video helpful, don't hesitate to leave a comment below. Now, let's talk about a very serious sign that might not always seem as urgent at first. High fever with a stiff neck and sensitivity to light. You probably had a fever before, right? It's usually the body's way of fighting off an infection. But if you've ever had a fever that was accompanied by a stiff neck, or you couldn't tolerate bright lights, that's something entirely different. These symptoms could be a sign of meningitis, a life-threatening infection that causes inflammation of protective layers around the brain and spinal cord. Meningitis can be more common in younger people, but older adults are still at risk, especially if they have weakened immune systems or other health issues. And when the symptoms appear, it's important not to ignore them, because things can move quickly. What starts as a mild headache or a little fever can escalate into something much more dangerous. That's why when a senior walks into an emergency room with a fever and sensitivity to light, doctors act immediately. Take Jerry, a 75-year-old man who loved crossword puzzles. One morning, he couldn't finish his usual puzzle because of a terrible headache. By afternoon, his neck was so stiff that he couldn't even look down, and the light from the kitchen window was unbearable. His neighbor, who was a retired nurse, recognized the signs and immediately took him to the hospital. It turned out that Jerry had bacterial meningitis. Thanks to the fast treatment, he made a full recovery. The key takeaway from Jerry's story is this: when your body is showing symptoms like fever, a stiff neck, and light sensitivity, it's not something you want to sleep off or try to treat on your own. These are signs of something attacking your nervous system, and every hour counts. If you ever experience this combination of symptoms, get to the emergency room right away. Don't wait. Early treatment can make all the difference in your recovery. So, let's take a step back for a moment and think about everything we've talked about. All of these signs, from slurred speech to chest pain, confusion, severe abdominal pain, persistent vomiting, and those serious symptoms of meningitis, are your body's way of telling you that something needs attention. But I want you to know that recognizing these signs doesn't mean that something is automatically wrong. It just means that if you see them, you should take action. And the sooner you do, the more likely you are to get the help you need to stay healthy. You see, these aren't just things to worry about. They're clues that can help you take charge of your health. The sooner you act, the more likely you are to recover fully and avoid bigger issues down the road. And it's not just about surviving longer. It's about living better. You deserve to feel well, to live without constant worry, and to enjoy the best quality of life possible. That means paying attention to the little things, recognizing when something isn't quite right, and taking action when it matters most. As we get older, our bodies change, and sometimes it can feel like things are breaking down a little bit. But don't let that discourage you. Every day is an opportunity to take better care of yourself and to stay strong, independent, and healthy for as long as possible. And taking those little steps, like recognizing the warning signs, can help you live a full, vibrant life. I hope this video has helped you see how important it is to listen to your body and respond when it needs you. If you learned something valuable today, I'd love to hear your thoughts. Please leave a comment below and share one thing you learned, or if you've ever experienced any of these warning signs yourself. Your story could help others feel more confident about taking charge of their health. And if you found this video helpful, don't forget to like, share, and subscribe. Your support makes it possible for us to keep creating content that helps you live your healthiest life. Finally, I want to leave you with this. Don't wait for the perfect moment to take care of your health. The best time is right now. You're in charge of your body and your future, and the small actions you take today can make all the difference tomorrow. Take care of yourself, stay aware, and don't hesitate to get help when you need it. You deserve to feel good, live well, and enjoy every day to its fullest. Thank you for watching, and I'll see you in the next video. Stay healthy and take care.